This is the skin cancer that I'm going to be having cut out. It's kind of like a little pink circle at the moment because that's where they took the biopsy. Welcome to Roughing It with Ruth, the channel where everything is a bit rough around the edges. I'm Ruth, and in this video I'm going to show you my recovery from a Mohs surgical procedure to cut out some skin cancer on my face. This recovery is going to be from directly after the procedure up until I get the bandages and the stitches out. So I will be showing you at the end of this video what is actually underneath all of these bandages. If you are interested in seeing the day of the Mohs procedure itself and how I got ready for that and going along with me to the hospital, then I will put a link in the video description to that video and you can go and check that out now. Okay, so I'm back home. At the moment it's the day after the whole Mohs procedure. I must say, when I got home last night, I was in quite a bit of pain. Like, all the local anesthetic had worn off and this was quite sore, this whole area. But then luckily my husband had already gone and got my prescription, which included some fairly hardcore pain medication. So I just took some of that and went straight to sleep. And then at about 3 in the morning I woke up from the pain again and then took more of those tablets, and it's after 9, it's like 9:30 in the morning, and I've been sleeping until now and I'm feeling a lot better. I can feel it here. I can definitely feel that there's something here, but it's not as painful anymore. Okay, so it's 2 days after the Mohs procedure. It's Friday now, and I had the procedure done on Wednesday, and I'm just on my way to the plastic surgeon who deals with the wound after the surgery. But I'm just going to go and get this dressing changed. You can see there's like a little bit of blood and stuff, and like this side is lifting up, so I'm just going to get that changed before the weekend, and then hopefully that can stay on until my follow-up appointment with the plastic surgeon on Wednesday. So I'm back from the plastic surgeon, and this is the new dressing that they put on. I think it's kind of basically just like a big steri strip that they stuck over the area, but it is quite a lot nicer because it's smaller and it doesn't get in my eyes so much, which is really great. It is kind of painful now, like touching this area does make it quite sore, and obviously to take the old dressing off and put a new one on, it had to get touched. So I'm definitely going to take my pain pills now and maybe just have a bit of a sleep. This morning, for the first time, I'm going on an excursion outside of the house that doesn't have to do with like changing the bandage on this. We're just going to walk to a coffee shop near us for breakfast, which I'm a little nervous about. I am still kind of self-conscious about this bandage on my face, but at least a lot of the bruising around my eyes has kind of gone away. There is still a little bit. You can kind of see it's slightly yellow, and the swelling has gone down quite a lot. So hopefully I don't look too terribly weird. Okay, so we went for our walk to the coffee shop earlier this morning, and it was actually nice to get out, but I did feel like really tired afterwards, like kind of strangely tired. So I think maybe my body is just like taking slightly more strain than usual after this whole procedure. Other than that, the pain and stuff hasn't really been bad. It was mostly like the first kind of 2.5 days to 3 days where the pain was enough that I actually took pain meds for it. But now it's pretty manageable. The only thing that really hurts is if I make certain expressions accidentally, like particularly like a surprised expression, it pulls here, obviously where the stitches are, and that hurts quite a lot. So I try not to make those kinds of expressions. So as you might be able to tell, my bandage is now different, and that's because last night, which was Monday night, my bandage actually fell off. I like very lightly kind of grazed my hand across my forehead and the whole bandage just came off. But anyway, I then sent a picture to the person that I'm dealing with at the plastic surgeon's offices, and she just suggested putting another breathable plaster on, which I have done. It's now Tuesday. And tomorrow, Wednesday, I actually have an appointment to go back there and see that same lady again. And she's going to take a look at the wound and make sure that everything's fine and potentially take the stitches out. Although from what I saw of the wound, I don't think they're going to be able to take the stitches out tomorrow. But I guess I'll see what they say. It was the first time that I had seen this wound at all when that bandage fell off last night. And at first I was pretty shocked. Like, I know it's a wound. You know that it's going to be a wound, and you can see the size of the bandage. You know it's going to be kind of a big wound and they're going to be stitches. But like knowing that intellectually and actually seeing it are two different things. Sorry about the cat. He's just having a lovely time fooling around behind me. Probably going to push something off just now. My husband had the best reaction ever. I am a massive Harry Potter fan, and when he saw the stitches, he was like, oh wow, that's definitely going to make a lightning-shaped scar. Which was definitely the right thing to say. That made me feel a lot better about the whole thing. Okay, so we just got back from the plastic surgeon, and they cannot take out my stitches yet. The skin hasn't healed enough. So I've got another follow-up appointment in another week. So the stitches will be in for the full 2 weeks. And they put a different dressing on. It's like these strips of skin-colored tape, and underneath those strips there's some other kind of, it looks almost like tape that's got iodine in it to prevent infection. I'm not very convinced that this is going to stay on for a whole week. I can already see parts of it lifting, so I don't know, we'll have to see what happens with this. Good morning, it is Saturday now, so it's been 3 days since I had this new dressing put on, and contrary to my expectations, it actually seems to be staying on really well. It still kind of looks like it might come off in some places, but it's not coming off at all, so I'm hopeful that it is actually going to last all the way until Wednesday, which will be a week, and then hopefully I can get the dressing off and the stitches out. Okay, so I was not expecting to do this today. It is Saturday night right now, and I'm supposed to go back on Wednesday to get the dressing removed, but suddenly now in the night it started getting like incredibly itchy and irritated and like kind of almost painful. So I have a WhatsApp number for someone at the plastic surgeon's offices. She's such an angel. She like answers my questions when I send her stuff in the middle of the night on a Saturday night on the weekend. And she said I must just take the dressing off and keep it dry and clean. I'm going to take my hand away so that you can see what's under here, but just fair warning, it is a line of stitches, quite a large jagged line of stitches, and if that kind of thing freaks you out, then definitely look away from the video now, and I will tell you when you can look back at the video. Okay, I'm taking my hand away now. So this is what it looks like. The only part of it that's like kind of sore is this part here. And I have sent a picture to the same lady, so if she thinks there's any kind of issue, then I'm sure she'll let me know. But I'm just gonna do what she tells me to do. I'm gonna put my hand back, and you can look back at the screen now if you've been looking away so that you don't see the gory stuff. Yeah, I do have to go to a social event tomorrow. It's a farewell for some friends of ours. So it's going to be quite interesting looking like Frankenstein's monster walking in there. But, oh well. I think it's also, like the stitches make it more noticeable rather than less noticeable. But it's okay. It'll be fine. I'm going to give it another clean tomorrow as well. So I just went to the plastic surgeon for a follow-up, and they did actually remove the stitches, but they've just put some more micropore plaster here because there was one area that had like a little scab that is not fully healed, and then obviously the places where the stitches came out of, those little like tiny holes, obviously also need to heal. So this micropore tape is meant to stay on until Friday. It's Monday now. They actually, after looking at the photos that I sent them when I removed the previous dressing over the weekend, they suggested that I come in on Monday instead of on Wednesday to have the stitches removed. So I did, and they said it's looking good. There's nothing wrong with it. They just wanted to heal as nicely as possible, which is why they put the micropore tape on to try and give it the best chance of looking good. So hopefully this is going to come off on Friday, and hopefully at that point it'll be like totally healed. Right, so today is Friday and I just came back from going to a follow-up with the plastic surgeon, and they did remove the dressing and obviously the stitches were taken out on Monday, but they have put this clear silicone dressing over the top of the scar because apparently silicone is proven to reduce scarring, and then they told me to massage it twice a day as well. And I also am still not allowed to get this wet, so unfortunately showers are not yet on the horizon, but it's not looking too bad. And obviously this is the worst it's ever going to look. It will gradually fade and lighten up. So I'm actually pretty happy with how things stand. Thank you so much for watching this video. If you're interested in seeing how the scar fades over time, then I suggest that you subscribe to my channel so that you can pop by every now and then to see videos that I make in the future. I mostly make videos about hiking and backpacking and outdoor adventures.